it's time for part 3 of the head, ears, eyes, nose, and throat assessment. And this side will focus on the ears. So just like the rest of your assessment, you're going to start with inspection. So you're inspecting the ears for symmetry along the head, okay? And you're also noting the size and shape of the ear. They're both symmetrical, they're in the same location on each side, and they're not abnormally large or small. Okay? I'm also going to be noting any lesions, lumps, and swelling along the ears, and then palpating to see if she's feeling any tenderness. Any tenderness? No. Okay. You're also going to want to be looking for any drainage coming out of the ear. So clear watery drainage could mean that your patient has had a basal skull fracture or trauma to that ear. Also, any frank blood, meaning that bright red blood, could mean a trauma to the ear or a result of the ear infection. Okay. I don't see any drainage, okay, and you're not feeling any pain. So I'm going to go ahead with my ear test. So there's several we can do. The first I'm going to do with the tuning fork. Okay. The first one is called the Weber test. So you're going to strike your tuning fork on your hand, place it on the top of their head, and they should be feeling and hearing a vibration bilaterally. If they hear or feel the sound more in one ear versus the other, it could mean they have conductive hearing loss in that particular ear. So that was the Weber test. The next is going to be the Rhine test. So again, you're going to strike your tuning fork, place the bottom against the base of the skull, and the patient will tell you when they stop feeling it. Now, then you flip it, and they're going to tell you when they're going to stop hearing it. Now. So with the Rhine test, you're testing air conduction versus bone conduction. And bone conduction will be less than your air. In other words, they can hear it longer than they can feel it. Okay? So air conduction greater than bone conduction. Lastly, we're going to do the whisper voice test. This is going to test for your high frequency sounds in your ears. So I'm going to place my hand over the tragus and whisper into her ear 3 random numbers, and she's going to tell me what she hears.
631. 592.
Very good. So she didn't hear, wasn't able to repeat a number or any letters that you just have to choose. She could have problems hearing high frequency sounds. Okay. Finally, for the ears, we're going to do something that's a little more advanced practice, which is going to be using the otoscope. Before the otoscope, you're actually going to take it and flip it upside down. And when we're using it, because she's an adult over the age of 2, I'm going to pull the pinna up and back before I insert this into the ear canal. So when I'm inserting this in the ear canal, I'm looking for what's called the tympanic membrane, or the eardrum. And the reflection of the light from the otoscope will make what's called a cone of light on the tympanic membrane. In the right ear, the cone of light is going to be looking like a 5 o'clock, as it would on a clock. And in the left, it would be facing 7 o'clock. When you're visualizing the tympanic membrane, it should look like a pearly gray without any air bubbles, no redness or perforations to it. And you have perfect membranes. So again, when you're looking through the otoscope, you'll be a 5 o'clock light, or a 5 o'clock cone of light on the right side, and a 7 o'clock on the left. That's it for the ear.